As Cooper continues to expand care for patients with intellectual and developmental disabilities, you may encounter more individuals with IDD across our healthcare campuses. These disabilities often present unique challenges, which can be complex to navigate in a healthcare environment. When working with IDD patients, it's essential to recognize that the hospital setting may feel overwhelming, especially for someone who may struggle to fully communicate their needs or emotions. In stressful moments, IDD patients may exhibit behaviors such as aggression, which require mindful interventions like de-escalation techniques, or in rare cases, chemical or physical restraints.
It's important to remember that these behaviors are not personal. They are a form of communication. Managing aggressive behaviors thoughtfully involves addressing both cognitive and emotional regulation needs. De-escalation requires a calm, empathetic, and structured approach. Here are some practical tips. Stay calm and non-threatening. Avoid mirroring the patient's intensity. Keep your voice calm and your body language open and non-threatening. Practice active listening. If the patient can express frustrations, listen without interrupting, acknowledging their emotions and concerns. Maintain a safe distance. Stand at a safe, non-threatening distance, typically about arm's length, allowing the patient personal space while ensuring your own safety. As you continue to work to de-escalate the situation, be sure to communicate clearly and simply. Speak softly and clearly using short sentences. Offer a simple, clear choices to give patients a sense of control. Break instructions into small steps and allow time for processing. Stay neutral and avoid arguments. Even if the patient becomes hostile, avoid responding defensively. Remaining neutral can reinforce that you are there to support them. Validate without endorsing behavior. Acknowledge their feelings to help them begin to self-regulating, without agreeing to inappropriate behavior. Set clear, calm boundaries. Communicate expectations firmly but calmly to reinforce structure and safety. Allow time and space for self-regulation. Silence can sometimes help the patient calm down on their own. Address unmet needs. Check for signs of unmet needs, like hunger, pain, or discomfort, which can often trigger behavioral responses that the patient may be unable to verbalize. Redirect and distract. Offering a favorite object, snack, calming music, or TV can help diffuse tension and prevent escalation. Sensory tools, such as the mobile sensory cart, weighted blankets, fidget toys, or noise-canceling headphones may also aid in de-escalation. Finally, know when to call for help. If the patient becomes aggressive, it may be necessary to use physical or chemical restraints, though these are last resort measures.
Creating a supportive and safe environment grounded in empathy and respect is the cornerstone of care for patients with IDD. When we treat every patient with kindness and respect regardless of behavior, we reinforce their value and worth. Building trust through consistent, compassionate, and non-judgmental interactions can transform the care experience, helping patients feel safe, understood, and empowered. By applying these techniques, we can promote the best outcomes for our patients and support our healthcare teams in providing compassionate, effective care for IDD patients who may exhibit challenging behaviors.